To be none, it can be tabled. I move to question number 9, Honourable Maryan Street.
Thank you, Mr Speaker. My question is to the Minister of Health and asks what reports, if any, has he received on the impact of increasing prescription charges?
Honourable Tony Ryle.
Mr Speaker, including articles, letters, ministry reports and such like, as well as other documents, I've received a number of reports, too many to detail here. The $2 increase per item, or a maximum of $40 a year per family, is the first increase in 20 years, which has helped fund cost pressures and new investments in the health service.
Supplementary question, Honourable Maryan Street.
To the Minister, is he aware of a University of Otago report last year that said that 276,000 adults were estimated to have found cost a barrier to picking up prescription items, even at $3 an item, and how did he factor this information into his decision to increase charges to $5 an item?
Honourable Tony Ryle.
Yes, I'm aware of that survey. I'm also aware that it didn't have any comparative information from earlier years. There have always been some people who don't pick up their pharmaceuticals, and that is disappointing because support is available. In fact, almost 1/3 of all prescriptions filled in New Zealand are done so without any charge to the patient.
Supplementary
question, the Honourable Maryan Street.
To the Minister, is he aware that the chaos surrounding the prescription charge increase and the pharmacy contract with DHBs has meant that pharmacists are now charging anything from $5 to $10 a week for blister packs on top of the new charges, so that a pensioner who has written to me recently in Christchurch, who requires 10 medicines daily, now has to pay an extra $6 a week to get his medicines in this usable and reliable form, and that means forking out in excess of $300 per year extra for his medicines as a result of these changes.
Honourable Tony Ryle.
Mr Speaker, the changes in this question with respect to the prescription charge are unrelated to the other parts of the member's question. The fact is the increase in the prescription charge was implemented quite smoothly. What is important for people to realise with the prescription charges is there is a maximum extra cost for any family of $40 a year. Once they get to a prescription services card per family, they need to pay for no extra over 20 items. This information is available in pharmacies, general practice and on the Ministry of Health website.
Supplementary question.
Honourable Maryan Street.
Does he understand that the fee paid to pharmacists for dispensing medicines is linked to patients' co-payments, that is, the $5 charge, and does he therefore acknowledge that it is costing people more than simply the $2 increase per item to pick up their scripts?
Honourable Tony Ryle.
I don't think the member's description has validity in light of the new transitional arrangements that we have in the pharmacy sector. But what is important to remember is if members have constituents who feel that they're under pressure with the increased prescription charges, those patients should be advised to talk to their GP, their pharmacist, or make sure they can be in touch with the work and income that can provide support.
Supplementary question, Honourable Maryan Street.
To the Minister, how does he reconcile the recent prescription charge increase from $3 to $5 an item with his statement of 11 September 2008, his guarantee of 30 July 2009, or his statement of 11 June 2011, that under National there would be no change to prescription charges, the government was not considering such an increase, and that that position would last for the term of the National government? Or is this another of National's broken promises?
Honourable Tony Ryle.
Mr Speaker, I certainly think that undertaking did stand for that term of that National government. But look, the fact is that the extra charges and the revenue that's being collected from these contributions are being reinvested in the health service, in more services for cancer patients, more preventative health care, expanding free after-hours doctor's visits for kids under the age of 5, and if any people are having difficulty meeting their prescription charge, they should talk to their GP, their pharmacist or Work and Income New Zealand.
Question number 10, Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Veterans Affairs, what